Awesome. Well, thank you so much, Heather, for that great introduction and for inviting us to speak to this group about something that is exciting to us anyway, which is benefits. So my name is Caitlane. I'm joined by Candice, and as Heather mentioned, we're both from Alberta Blue Cross. Candice will be attending that expo in Calgary, so you can find her there and see what her bottom half of the screen looks like when she's there. And typically we bring some pretty cool swag, so make sure to come say hello. Yes, ask all the questions that you have, and then just take away some swag too. So what are we going to talk about today? Well, we find benefits exciting, but it can sometimes be complicated. So we want to make sure we are sharing some information, things to think about when it comes to your health and dental benefits, whether that's what's covered through the government, how you can supplement those benefits. That's what we're really here to cover today. So in terms of what's on the docket, it really is what I just mentioned. The agenda will pop up on the screen there, and it'll share with you. We're going to start off by talking about the government-sponsored programs. Then that would include something called the non-group plan, which Candice will review. We'll cover the coverage for seniors plan, and then some other offerings through the provincial government that are available to you here in Alberta. Then the second part of the presentation, we'll talk about how do you supplement those government-sponsored programs with other benefits like dental, like vision, like paramedicals. So we'll review that together as well. And as Heather mentioned, we have that Q&A function on Zoom. So we'll make sure to take a look at that throughout the session. And then also at the end, we'll see how we can answer all those questions. And you'll also have our contact information. I'll pop up on the screen. We'll also put it in at the very, very end. So you can take that with you, and we'll go ahead and get started. So I'll pass things off to Candice to start off with those government-sponsored programs.
Great. Thanks, Caitlin, and thanks everyone for joining us today. First, we'll have a look at what's available provincially when it comes to government-sponsored programs. And really speaking and highlighting three of them, the first one being the provincial Alberta healthcare that's available to all Albertans. So just kind of recapping exactly what's included and covered on there. There's no cost for that Alberta healthcare, but what is covered include standard ward hospital accommodations, physician visits, and like medical treatments for surgeries. So that's what'll be available through Alberta Healthcare and the provincial health. The second one I just want to mention is called the non-group coverage. Now, this non-group plan, it is for individuals that are under the age of 65 for prescription medications. So this has an additional prescription coverage above and beyond the provincial health care. And what's covered on the non-group includes 70% coverage for prescriptions that are listed on the Alberta Drug Benefit List. That individual's portion to pay would be 30% or a maximum of $25. This program also does include a few additional things, ground and air ambulance. Oh, I'm sorry, it is just ground ambulance, 100% ground ambulance. Diabetic supplies are included on the non-group program. Registered psychology, registered home nursing, and preferred hospital accommodations. So for someone that needs or would like to have private or semi-private accommodations, that's available on the non-group. Now, the non-group for individuals that are under 65, it does have an attached premium. For single individuals, the cost is $63.50 per month. For families or anybody married or has dependents under Alberta Healthcare, they'll charge the family rate, which is $118. And then the last one, and we'll go into a little bit more detail on the next slide, is the coverage for seniors. So the coverage for seniors, this one is available to all Albertans 65 and over. There's no attached premium for the coverage for seniors program. Now you do need to register for this program by showing proof of age form, and that can be done through the alberta.ca website. There's also a link through our site from that proof of age form, or you can do that at any like a registry office that is an Alberta healthcare outlet. And the non-group program and the coverage for seniors, these programs are provided by Alberta Healthcare, but we do administer these programs on behalf of the government and process the claims for these government programs and the government options. And then for the coverage for seniors, so what's available and included, the main is prescription benefits. So it works very similar to the non-group coverage. It's going to cover 70% direct bill for any eligible medications that are found on the Alberta drug benefit list. The individual would then pay 30% or up to a maximum of $25 for that prescription pickup. So if the prescription pickup is $10, then that individual will pay $3. If the out-of-pocket portion is, let's say, $300, you're going to pay a maximum of $25 for that prescription pickup and anything eligible on the Alberta drug benefit list. The Alberta drug benefit list, it covers around 4,800 different types of eligible medications, and there's no maximum. So it's unlimited for anything that is on that eligible list for prescriptions. And then additionally, it has the 100% coverage for ground ambulance available. Diabetic supplies. There's registered psychology and a registered home nursing available on this program. However, this program does have chiropractic benefit included, which is not on the non-group program. So this is available on that coverage for seniors for anyone who is 65 and over. Once they submit that proof of age form, then they would get their Alberta Blue Cross card first of the month following their 65th birthday once they've registered, and can start using that at the pharmacy and coordinate that with any other programs if they have any other programs available to them. And then we just wanted to point out some additional government support. So on the government programs, there isn't dental or optical assistance. So there is a provincial dental and optical program available for seniors. However, it is separate from the prescription coverage for seniors that I just highlighted. So the dental and optical assistance, it is available based on income and available for individuals who are 65 and over that have low to moderate income. There's no medical review. They would just use your previous year's income tax to determine if you're eligible and for which amounts for dental and optical. So I certainly would recommend to contact the number that is listed here, the 1877 number, for anyone that wants more information on the thresholds and how to register for that program. Once an individual does register for the dental and optical, then every year it would just be re-evaluated when you submit your income tax, the threshold amounts that you're allotted for that year. With the government-sponsored programs, including coverage for seniors and the non-group, the benefit year starts from July 1st till June 30th. So for the coverage for seniors, it has that chiropractic benefit. That benefit is going to reset then on 1st of July because there is an annual maximum. for that. And I certainly would recommend looking at the alberta.ca website to just get a listing of those benefits and the maximums on the coverage for seniors. You can also go to our website, ab.bluecross.ca. Go to government sponsored programs and you'll see the proof of age and the benefit listings there as well. We'll also have brochures at the expo later in April too, so definitely feel free to come by and pick up a brochure which will have the complete details there as well, or I can be there to answer any questions. And then Alberta Aids to Daily Living. So this is available for all Albertans. It would be based on a healthcare assessment for different medical aids and supplies. So they have a wide variety of things that you can contact them for and see if you can get assistance for things like hearing aids, oxygen and equipment, canes, crutches, walkers, sleep apnea, appliances. So they've got a really wide variety of things. And this one to determine if you qualify or can get the assistance would be based on a healthcare assessment. For example, hearing aids, they would need like a hearing test and requisition from the doctor are the types of documents that they would look for. And then the best contact to reach is that 310-0000. However, I do have had experience, a lot more people have more success just calling the 780 number and the local number to get through. So I've put both there so that you have both of those contact numbers. And there is information on alberta.ca website about both of these programs as well. If you need a bit more information or just another resource to find that. Now, these government programs, they're really great and definitely offer that assistance above and beyond what's available through Alberta Healthcare. However, for individuals that do need a bit more coverage, if they don't qualify for the dental and optical, maybe need a supplemental plan, we do have some options at Alberta Blue Cross, and I'll hand things over to Caitlane just to outline those personal options to supplement.
Awesome. Thanks so much, Candice. So as Candice reviewed, there are some really great programs that are available through the provincial government, like the Coverage for Seniors Plan, like non-group. However, for some individuals, what's covered under those programs is not enough for what they're looking for. They want things like vision and paramedicals, perhaps something that might be more closely to what you've been using through a work plan, for example. So as a result, we'd like to share with you some different options to help supplement those great government-sponsored programs that are already available. So before we get into that, I just wanted to share a little bit of background behind Alberta Blue Cross. So I'm sure many of you have heard of Alberta Blue Cross, and I'm not sure if you're aware, we are an Alberta-based, Alberta-grown organization that's a not-for-profit organization, and we've been in that health insurance industry for actually over 75 years. I believe we celebrated that birthday just last year. And with that, we cover 1.8 million members under Alberta Blue Cross, and 8 in 10 individuals, 8 in 10 Albertans do choose us here at Alberta Blue Cross to help them with their health and dental plans and benefits. Now, what are the two different plans we want to discuss today? Well, there's going to be many different options for all stages and all ages here at Alberta Blue Cross, but the ones we wanted to review with this group today are called the Blue Assured and the Retiree plan. So the Blue Assured plan is something that's available for all ages, all stages. So we'll go through some highlights of that. Then we'll talk about that retiree plan, and this one has some eligibility criteria to it. So to get onto that retiree plan, you're going to be 50 years of age and over and be coming from another benefit plan, like a work plan or an alternative individual plan. We'll get into that a little bit more in a couple of slides, but just really wanted to share those plan features of all the different personal plans that we have here at Alberta Blue Cross. So the first one on the bottom right is you'll see that we offer flexible solutions. So based on our plan design, which I'll share with you in the next slide, is you have the ability to pick and choose your levels of coverage based on what your needs are. So for example, you may have some of those government sponsored programs. What are the different types of coverage? What benefits do you need to supplement with? And from there, you can really pick and choose a plan that's the best fit for you. With that flexible solution piece is the ability to upgrade levels of coverage at any time. So we understand as life goes on, things change and your needs change. So we wanted to be able to give that flexibility and choice to you with your health and dental benefits. If you've ever been on an Alberta Blue Cross benefit plan, you'll see that we do have a focus on wellness within the organization, and that really doesn't stop. So through all ages and stages of life, we do have this focus on wellness, and there are a whole bunch of different wellness tools to help you throughout your wellness journey. And I know we'll be at the Seniors Expo to answer any and all of your questions, but one thing that we like to share with you is that we have benefit specialists that can assist you throughout your entire benefit journey. So if any of you have questions outside of today, certainly reach out to Candice and I, and we can connect you with a benefit specialist that can help guide you through what benefit plan might be the best one for you. They'll assess your needs. They'll help you go through the entire application process. And once you're already even on the plan, they can assist you all the way through while you're on the plan. So something that is really unique to Alberta Blue Cross. You can certainly do everything online as well. However, we have those benefit specialists to help you throughout the way. And all to say, we offer all of these different plan features with the confidence and security from a brand you all know and trust. Now, what does that flexible solution piece really mean? So you'll see on the table on the screen, there's going to be 3 different categories on the left-hand side. So there's prescription drugs, there's dental benefits, and there's extended health benefits. Across the top, you'll see level A, B, C, or D, and level D is going to be the most comprehensive level across all 3 categories. You'll notice that there are different check marks under different levels for each of the categories, really just showcasing that flexibility and choice. You're able to customize the plan that's the right fit for you. And depending which plan you choose, you'll have the option to opt out of the dental portion or perhaps even opt out of the prescription portion, depending on what your needs are. And we'll go through that a little bit in more depth in the next couple of slides. One thing I do want to remind you of, we did talk about it, is you can upgrade your levels of coverage at any time on these personal plans. So whether that's from level A to level B, or even level 8 all the way to level D, you can certainly do that. And that will be effective for the first of the following month that you make that request. Now, one thing to keep in mind is if you're wanting to downgrade levels of coverage, there is an industry standard 24-month waiting period to do so. So just keep that in mind as you're choosing your levels. So we always recommend starting on the lower levels of coverage and upgrading as needed. Now, let's take us back to those 2 different plans I mentioned earlier. The first one is going to be Blue Assured. So again, this one's for all ages, all stages. You'll see that there's those 3 categories again, prescription drugs, dental, and extended health benefits. So for Blue Assured, the prescription coverage is optional. So there is a maximum coverage of up to $1,500, but you have the option of opting out of the prescription drug coverage. The next is dental coverage with a coverage up to a maximum of $1,500. And again, the dental portion is going to be optional. The third thing on here is extended health benefits, and that'll offer coverage up to $5,000. Now this one isn't optional. However, you have that ability to choose all the way from level A to level D, depending on what your needs are. For any of you that are interested in travel, this also has travel embedded, up to 30 days until age 65. And for the Blue Assured plan, there is no medical questionnaire required. And the beauty of the Blue Assured plan is it really complements the government sponsored program. So for any of you that are on the non-group plan or are on the coverage for seniors plan, that has prescription coverage. So if you feel like that's going to be enough, you can opt out of the prescription coverage on the Blue Assured plan and then have access to dental and extended health benefits. All right, so now we're going to talk about that retiree plan. So another option here at Alberta Blue Cross. Again, this one has some eligibility criteria. So the first one being you must be age 50 and over and be coming off of a different health plan within 90 days to be eligible. So another health plan might look like work plan that you had, and if you are retiring, now coming off and looking for personal benefits, or perhaps you have another personal plan from a different carrier and you'd like to transition onto Alberta Blue Cross retiree plan, you can certainly do that as well. Again, you'll see those are 3 categories: prescription, dental, and extended health benefits. For the retiree plan, you must choose a level for prescription drugs, and that will have a coverage up to $5,000. There's dental coverage up to $5,000 as well. Now, the dental and the retiree plan is also optional. The extended health benefits are going to offer up to $7,500, and there is travel coverage embedded in this one as well, up to 120 days. There aren't any waiting periods on the retiree plan, and similar to the Blue Assured plan, there is no medical questionnaire required. Now, what you might have noticed between the 2 plans is the retiree plan does offer some higher maximums, and it also offers travel without a termination age. So depending on what you're looking for in a benefit plan, that might help guide you in which one might be a better fit for you. Just keep in mind that the premiums will then be dependent on the coverage that you choose as well as your age. So with that, I'm going to pass things over to Candice, who's going to share with you the different wellness tools that are available on these plans.
Great. Okay. Yeah. So we'll look at these wellness tools. First, starting with the Balance program. So this is available to all of our members through our online app. So once you do have a Blue Cross card, whether that be with the coverage for seniors, non-group, or one of the supplementary programs, you can sign up for our member services application, create a username and password, and then the Balance program would be available for you. And when you navigate to the Balance portion on the application, you'll see different things that you can access. You can complete health risk assessment, which helps keep track of your goals. You can set yourself quarterly reminders and specific goals to, accomplish different things like monitoring and keeping your blood pressure or cholesterol down. Also, there's a lot of really great expert learn and earn videos, even recipes, blogs that you can access. So really a lot of great information and a really great resource to help maintain health. And a lot of the activity, most of the activity you do on this program, you start to earn points. And you can use those points to bid on rewards and gift cards. So a lot of really great information, and you have the opportunity to earn gift cards and rewards. And the other thing that's available, so this is available on our website, it's care navigation. So for anyone that is diagnosed with a condition or illness, then there's really great resources, vetted articles that you can access to really help navigate those diagnoses in those situations. And through the retiree program and the Blue Assured program that Caitlin had mentioned, what's available is our individual assistance program. So this provides 12 one-hour sessions per calendar year for professional counseling services. So this is above and beyond any of the registered psychology benefit maximums. In addition to that psychology benefit, then these 12 sessions for a professional counselor through Homewood Health are going to be available on Blue Assured and the Retiree program. And they have professional counselors across Alberta you can access by phone, in person, or online. Everything from grief and bereavement, financial counseling, legal assistance. You can even connect them for weight loss and nutrition, a professional counselor through this program here as well. And then the last one is Blue Advantage. So this is a discount program for our members. This would be available again to anyone that does have an Alberta Blue Cross ID card would be able to access the Blue Advantage program. And there's different partners throughout Alberta, even Canada-wide, that partner with us and offer a discount to our members. Everything from hearing aids, there's different laser vision that you can access, optical, so frames and lenses. Last I had checked, Hakeem Optical was offering a 30% discount towards frames or lenses. So that's a really great resource for savings on some of these purchases. Even there's gym memberships. It does change from time to time, so I definitely recommend checking the list and even just making sure. I know for Loblaws or Superstore, there's certain locations that participate, so it's always good just to make sure of the partner, and then you just need to show your ID card. And they would provide the discount. You can even utilize that discount on top of a benefit maximum or a benefit amount. If you have like the Blue Assured or the retiree plan in place, you can utilize the percentage on top of it. Now with the retiree program or the Blue Assured program that Caitlin had mentioned, can be accessed through our website. There's also a lot of really great resources on our website, including our retirement guide, which includes different information on like financial planning upon retirement, government sponsored benefit programs can be accessed. There's even a really great section right on the homepage that talks about the federal dental program upcoming. So some really great resources to access. The website can be accessed through any mobile device or desktop, laptop, computer. And it's ab.bluecross.ca. And then certainly for like the Blue Assured and the retiree program or any of our personal plans, they are also listed there as well. You can do a quote online for any of our personal programs like the Blue Assured and the retiree, view all the benefit details and their full maximums, and you can even complete an application from start to finish and get your ID card and print it off right away online. You can also connect with one of our benefit consultants. Caitlin mentioned they're a really great resource, and they really truly are for anyone that does have specific needs or specific medications that they have inquiries about. Then our benefit consultants can speak to the government sponsored programs as well as these personal options to find the best fit for you. Make sure your medications are going to be eligible and that you have enough coverage to get you through the year for anything specific. They can help you pick and choose the levels of coverage if you're looking at Blue Assured or retiree to make sure you're not overpaying for any benefits. And then they can help tailor it to what you need and what your specific requirements are. They can also provide pricing for you over the phone. And if you've decided to go ahead with any particular program, they can even help you apply right over the phone, so that you don't even have to go online. You can just do the phone application with one of our consultants to get that program started for you. So definitely recommend them. Really great resource to access. And a few other things that you'll find on the website, personal travel options. So we do have like trip cancellation and trip interruption coverage available. You can do a quote online, or you can talk to one of our travel agents, and they would be able to further help and further assist with any travel inquiries. You can purchase annual policies or top up, or the trip cancellation insurance, interruption, and baggage. So there's lots of different types of travel that we have for personal individuals to purchase as well. So definitely you can get a quote or purchase those through one of our travel agents or online. And I wanted to just highlight, in particular for the trip cancellation, it would include this flight delay service. So flight delay service is something we're really excited about here at Alberta Blue Cross because it is new. So the retiree program that Caitlane had mentioned, any of the travel benefits on the retiree program are going to include this flight delay service, as well as anyone that purchases just trip cancellation or trip interruption through one of our travel agents, then this flight delay service is going to be included. And what that includes is anyone who's delayed 3+ hours, they're going to receive a voucher to an airport lounge, or the equivalent dollar amount you see here. For anyone that's delayed 6+ hours, they'll receive a voucher for hotel accommodations. And if a hotel is not available, would get that compensated amount there if the hotel is not available. And it's a really easy application. You just need to input your flight number and up to an hour before you depart, and it will capture any delays and for how long, and then work out everything in the back end. So that's new. It's included on the retiree with all travel and the trip cancellation if that's purchased separately. And the last thing you'll notice on the website, we do have personal options for life insurance as well. Again, we have experts that you can contact for the life insurance options. You can also go online and do quotes online as well and just get an idea on the pricing, or contact one of our life consultants, and they'll be able to go through the different options. And again, specific to your needs and what that looks like for you, and assist with that. And with that, that is the end of our presentation. So we're definitely just happy to go through the questions that are coming through the Q&A there and just speak to those.
Awesome. Yeah, so I can share the questions that came in through the Q&A for us to review together. The first one's asking, does the dental plan D for retirees include dental implants?
So for the level C and level D both do have coverage for implants. So both C and D offer extensive dental, which include crowns, bridges, and implants. Certainly, if you have some upcoming dental work, definitely connect with one of our benefit consultants just to really verify any like your specific scenario or situations. For anyone that is getting extensive dental work done, I definitely recommend getting like a pre-authorization or a predetermination if you already have a supplementary program in place, because then it will let you know between any government sponsored programs, any paid programs that you're on, what the insurance company is going to pay, what Blue Cross is going to pay, and then what your out-of-pocket portions are. Just that way you're not stuck with any nasty dental bills at the end, and you know what to anticipate before you even have the work done.
Great, thanks, Candice. The next one is going to ask, how is the pharmacare and dental care being rolled out by the federal government plans affecting coverage here at Alberta Blue Cross?
Yeah, so the federal dental is upcoming. We have adjusted all of our individual plans to include the opt-out. So you can certainly opt out of the dental portion and then still maintain the other benefit coverages like extended health or the additional prescription benefits. So that's not affected. There's a really great resource too listed right on the main page of our website, and we'll pop that in the chat here before we go, but it's a really great resource that helps answer a lot of questions on the federal dental program. And it'll outline the different ages, because there are different tiers that they're going to be rolling it out. And I definitely would recommend, before you make any changes to any existing programs, to verify exactly what you're eligible for, or make sure you know what you're eligible for. Because in addition to the age intervals that they're rolling it out to, there's also an income threshold. So just really wanting to make sure too, before you cancel or opt out of anything, that you have enough coverage and know exactly what your eligibility is going to look like first.
Awesome. Thanks, Candice. And I just popped that link to the blog that Candice just mentioned in the chat. So feel free to just click on it and it'll take you right to that article there. The next question is, if you are married and one of you is 65, do you have to use combined income for eligibility? So
for the dental and optical assistance, which does require income eligibility, the threshold amounts are based on household income. I'm not sure exactly what those thresholds look like, so that's where I would recommend contacting the 1877 number to determine that threshold amount, but it is based on household income.
Awesome, thank you. So these are some of the questions we answered earlier in the chat as well. So a lot of them were asking if they have non-group coverage and they're turning 65, do they still need to apply for the seniors coverage, and how do they do this?
Yes, so anyone that does have the non-group, you still need to register for the coverage for seniors by filling out that proof of age form. So that can be accessed through alberta.ca website. There's also a link on our website, and then if you navigate to government sponsored programs, or you can go to a registry office. So any vehicle registry office that is also an Alberta healthcare outlet, you can go and complete your proof of age. So they just require a government issued ID, birth certificate, passport, driver's license, and you can just show that at the counter at the registry office, and then they will register you. There's also a package that typically goes out from Alberta Healthcare 3 to 6 months prior to your 65th birthday. And in that package, you'll also find the proof of age form, as well as the dental and optical, which is, I believe the form is actually named like seniors housing assistance. So that's what you would kind of look for in the package. So any one of those ways to do the proof of age. Once you complete the proof of age form, because both programs are registered with Alberta Healthcare, it's automatically going to not charge you anymore for the non-group. And first of the month following your 65th birthday, the coverage for seniors will just kick in and the non-group will just stop. You don't need to, call or cancel it or anything like that.
Great. And then I think you answered this. How do you apply for coverage? So as Candice mentioned, for those government sponsored programs, those are the different ways. In terms of personal benefits, certainly you can go online and do the whole process end to end. You can connect with one of our benefit consultants, and I'm just in the process of putting my email as well as Candice's email. So you can reach out to us directly if you have any other questions outside of what we've answered today.